I'm visiting with Dr. Jadine Anderson, who is a chiropractor. Dr. Anderson, how is a chiropractic adjustment performed?
A chiropractic adjustment is performed with the chiropractor doing his initial workup of the patient to find out where the specific bone is that's misaligned that needs to be realigned. That's done with the heat sensing instrument in my office to find the vertebral level, along with the palpation to find subtle changes within the spine, dealing with tenderness or lack of motion or too much motion, and then finding the specific bone that needs to be realigned. We look at an x-ray to see how the bone has moved so we can put our hands back on the bone and push it back in the proper direction. We take x-rays of the patient prior to the adjustment, and how I explain it to patients is I'm using it as a blueprint to see which way the bones have misaligned so that I can realign them and push them back in the proper direction.
Okay, thank you, Dr. Anderson.